Welcome to the show discussing problems and issues at Health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about high cholesterol. The last couple of shows, I went into all the details and the basic and the scientific background of all this other cholesterol stuff. I'll just give you the statistic today, and then we're going to begin to really talk about patient per se. In this country, 106,700,000 folks have high cholesterol. That is divided into 50,800,000 males, 55,900,000 females, 47.9% white males, 49%, 49.7% white females, 44.8% Negro slash black males, 42.1% Negro black females have high cholesterol. And some across the world, you have 39% of the 7.7 billion people, 39% adults have high cholesterol. In this country, you have 7 million children slash adolescents have high cholesterol. And as I stated the last few shows, high cholesterol is a genetically inherited problem. The abnormality is located in the long arm of chromosome 5, and that's the basic of the problem. If you inherited the cholesterol from both mom and dad, you are homozygote. If you inherited only from one parent, you are heterozygote, meaning that the homozygotes start having elevated cholesterol since they are children slash adolescent, and then those that are heterozygote start developing it when they get into adulthood and so on and so forth at different stages of the adulthood. The abnormality, as I mentioned last week, that is in the bloodstream itself that's causing the problem is a substance called hydroxymethylglutaryl-CoA reductase. And from now on, I'm going to refer to it as coenzyme A. The genetic abnormality that's located on the long arm of chromosome 5 causes overactivation of coenzyme A in the circulation of the blood, resulting in overabsorption of cholesterol from the food that we eat. That's the basic abnormality. Therefore, then, the diet that has a lot of fat in it plays a major role. Diet that has a lot of simple carbohydrate plays a major role, because whenever you eat or drink simple carbohydrate, i.e. simple sugar, regular sugar, by necessity the sugar goes into your system. Some of it is used for immediate energy. The rest is taken to the liver. It is broken down into fat. It becomes fat. Okay, the fat get deposited in the soft tissues. You get obese, and the rest of the fat sits in the liver. And in both places where the fats are, it causes you to have diseases of different types as well. In fact, as I mentioned last week, it is shocking for you to realize that cirrhosis of the liver is this very common abnormality that affects hundreds of millions of people across the world. The number one cause of cirrhosis of the liver happens to be obesity, resulting in fat infiltration of the liver. Yes, hepatitis A, hepatitis B, hepatitis C cause that. Alcohol abuse causes that. A whole lot of other problems that can cause cirrhosis of the liver can cause cirrhosis of the liver. But the number one cause, believe it or not, happens to be obesity. And obesity is a major, major, major disease throughout the world. In all the developed countries in the world, the country with the most obese individuals happen to be the United States of America, whereby close to 50% of adults in this country are obese, and some close to 19 million thereabout children slash adolescents are obese. It is incredible. An article just came out, I guess, late last week or earlier this week, showing that hundreds of millions of dollars are being spent by people who are selling junk food, specifically targeting young African American individual and young Hispanic individual. As bad as the situation is for these individuals as it relates to poverty in this country, yet hundreds of millions of dollars are spent to advertise junk food in the community where the young African American folks live and where the young Spanish folk live so that they can eat more of that junk food. I'm not here to list the list of the junk food, the names of the junk food. You know what they are. You know who's making them, and it is not the fault of the young people or adults as well who are eating this stuff, because in many instances they don't eat it as a luxury, as something you eat once in a while. They eat it because that's all they can afford. They eat it on a daily basis. Okay, so they're basically poisoning themselves, resulting in a lot of suffering and early death from stroke, heart attack, kidney failure, high problems, and all sorts of stuff, cirrhosis of the liver, and what have you. It is not a disgrace, nor is it a shame for anyone to be poor. If that's were the case, I would have been falling into the category, in that category as well, because I knew of no one in my days when I was growing up in Haiti that was poorer than I was, having lost my mother when I was 7 and lost my father when I was 9. And for all intents and purposes, I've been on my own since I was 7 years old. But suffice it to say, I never begged anybody for anything. Nor did I do anything that I can regret today because I was poor. I worked hard. Whatever the work was, I did it so that I can survive. Because I knew, the one thing that I knew that my mother told me since I was 5 years old, that I was, quote, her little genius. She told me, and she took me to a town in Haiti called M.A.C.P, to a group of Canadian brothers they called their frère de M.A.C P, to have me tested, my IQ, when I was 5 years old. She has the certificate. Unfortunately, I don't know where it is, but suffice it to say, after they kept me there for a day, my IQ was completely over the top. And they took me right there in school since I was 5 years old. So I don't know much about my mother because I left home when I was 5 years old. And 2 years later, she died. All I had going for me was the fact that she told me that, I believed it, and I knew that's all I had going for me. So I worked very hard, went through a whole lot of stuff to find myself here in this country because I heard that there was opportunity in the United States of America. And sure enough, through the help of God, I found my way here. So I got here February 1960. First week of March, I enrolled in school at PS 44 in Manhattan because that is all I came here for. Of all the problem I was having, I knew the only thing I had going for me was going to school. So poverty, to get yourself out of it, you must have a profession. You must have something that you could do that is needed out there so that people can give you a job so you could become financially independent. In addition to being able to educate yourself, the most disgusting thing that can happen is when you are shackled with the ignorance in terms of intellectual knowledge. How can you be independent if you can't think for yourself independently? But when you go to school, you remove that shackle of ignorance from your leg and you learn. You get your freedom of thought. You'll be able to think and concentrate and do things on your own. And that's what this great country, excuse me, has done for me. And when I see young men and women in this country struggling, it drives me, I get so upset because I know there is a way out. It's not easy. They're not going to make it easy for you. But you can't give up so early. You have got to discipline yourself. Stay away from problems and get yourself into school, no matter how hard it is. Just because you may not be as brilliant code as someone else, who cares if it takes you 5 hours to do something intellectually that somebody can do in 5 minutes? Doesn't make any difference. At the end of the day, nobody walks in the street with a certificate in front of in their face, in the chest to say that, you know, they get the diploma and such. Doesn't matter. The fact is you get your diploma. The diploma doesn't say that you get it. In fact, you get your diploma, you get your degree. So you got to go to school in order to free yourself. That is the surest way, the most decent way, the most honest way to do it. All the other stuff, it's not worth it. It doesn't have any longevity to it. So therefore then, and when you get to a point where you don't care if people don't accept you, but you dare them not to include you. And I'm a classic example of that. I don't look for anybody's acceptance. I couldn't care less. Because when I needed acceptance, when I was 7 years old, struggling, suffering from hunger, nobody gave a damn about me. Okay? Nobody. But if you are capable, then people will include you. You don't have a single medical organization in this country that's worth a grain of salt, that has any value, that I don't belong to, because that's called inclusion. For that matter, across the world. The Royal Society of Medicine, 1771. I'm part of it. I'm a fellow. The oldest organization in the world. And for that matter, I got accepted in that organization without filling out an application. My granddaughter went to see her get involved in her medical school graduation, and her then fiance, they took me to this incredible place in London to show me around. And they took me in this library of this great place. And then somehow she introduced me to the lady that was running this incredible library by Dr. Alcena. She said, now, wait a minute. You mean the Dr. Alcena? She said, yeah, that's my granddaddy. She picked up the phone. She called Sir so-and-so who was running the place. And the gentleman said to her on the telephone, could you please ask him to become a fellow? Let him sign the form. So to this day, I just sign at the bottom of the form. That's how I get to become a fellow of the Royal Society of Medicine. 1771 it was started. By standing up. Never sat down, never finished. I just signed at the bottom of the form. How about that? And people are begging throughout the world to become a fellow of this organization. They can't get in. And I got in by just standing at the counter. Because throughout Europe, I'm known as this, quote, famous Professor Alcena, who've done things that are benefiting hundreds of millions of people across the world. So let's get back then to cholesterol. So I've given you all the spiel. I'm going to explain to you now. Somebody shows up in your office. You take a history from them, he or she from her. We did a complete physical examination. You want to pay close attention at the blood pressure, the pulse. Look inside the eye. The eye is the only place in the human body we could actually see a naked vessel. That's right, a naked vessel. Yeah, It's incredible. There's a whole world back there that the ophthalmologists are incredible specialists when they put the open thing, put the stuff in your eye to open it that I can see back there. That's very important. When you look at somebody's eye, you look at the vessel, look at the sclera. Is it too pale? Is it yellow? Is it normal or whatever? Look at the pupils. Is the pupil too small? Is the pupil dilated? I remember once was covering for a group on Davis Avenue there at one time, briefly. and I get called for the old emergency room at White Plain Hospital. A patient who lives in Florida, she came to visit. She used to live in New York, but left. One of the doctor happens to belong to that group that I was covering for that night. Showed up in the ER. She's having severe headache, unsteady. Don't know this lady from Adams. She was reluctant in letting me examining her because this man of color showing at her bedside. She doesn't know me, I don't know her, but I was covering. I explained to her, calm her down. Ma'am, I'm just here to help you. You don't have to be afraid of me or whatever. And she says, okay. So I took my little pen. There's a pen that has a light on it. And I opened her eye. Before I do anything, I said, oh my God. She said, what do you mean, oh my God? I said, lady, you are in trouble. Let's get you to the X-ray department right away. I need a CAT scan of your head because I think you're bleeding. She says, I'm what? I said, yeah, I think you're bleeding because your pupil, I can tell the pupil tells me your brain is under pressure. And I remember a neurosurgeon who unfortunately passed away a few years ago. I had his phone number. I called him. I told him what I had just seen. I hadn't listened to the heart. To this day, I don't think I had a chance to listen to a heart. I just rushed right to this. Val, I'm coming. Rushed right to X-ray, get a CAT scan. Sure enough, she was bleeding into the brain. The brain was under pressure. That's why she was unsteady and having a headache. The guy come right in, rushed in, right in, took her to the OR immediately. On my word, he didn't even body Val, if took a rush to the OR, and then did his thing. Put a hole there. I think she had a subdural hematoma, whatever it was. Open it, the brain, release the pressure, save her life. And then a year or so later, I have a little office at 170 Maple Avenue. Somebody knocked at the door. See this lady and her son walked in with a basket full of fruit. Say, oh, Dr. Alcena, I come to, again, thank you for saving my mother's. I said, I barely remember. She said, yeah. You remember I was the one that wasn't even sure I wanted to examine me. You didn't know me. And you tell me, you calm me down, you look at my eye, you save my life by just looking at my eye. It's a true story. Okay, so you do that, look at the skin. Skin is super important, even though we're talking about cholesterol, because there's certain lipid problem that can cause things to get deposited on the skin. You look at that. Very important to look at the heart. Listen to the heart carefully. The heart abnormality that you could listen to because the cholesterol is high, that has damaged the heart and so on. Very, very important. Listen to the lungs. Examine the abdomen very carefully because there's a big organ in the chest and also in the abdomen called the aorta. That's the largest artery, as it were, in the abdomen and in the chest. So if there's plaque there that is narrowing a certain sound we could hear, we could also see certain palpations, a mass effect if that's about to be ruptured. Examine the groin, look at the pulse. Look for the pulse down the leg, very important to make sure that the pulse are okay, they're not obstructed. Very important to take your stethoscope. Not only palpation, but one side at a time. The carotid arteries on either side, because one of the common problems that occurs when somebody have hyperlipidemia is obstruction of the carotid arteries. You could tell on physical if there's an obstruction, certain sound you could hear. Right away that gives you a red flag. Do a neurological examination. It's crucial because the patient has had silent stroke, he or she didn't know. You could pick those things up. So now that you finish with your exam, now we're going to talk about blood tests. What are the blood tests you're going to do? Well, you're going to do a complete blood test, yes. Complete blood count. What are you looking for? You're looking to make sure there's no anemia in particular. You're looking to make sure that the platelets are okay, white blood cells are okay. You do a sedate, very important. I'll tell you the meaning of that later, if not in this segment, other segment. Then you proceed to do a complete chemistry profile, complete, involving the blood sugar, the BU and the creatinine, the electrolytes. Very, very important. The blood sugar, super. Take a look at the BU and the creatinine, because if you have high cholesterol, it metabolically damages the kidney. And then you could begin to see the abnormalities right there. Even though the patient has no symptom, the kidney may have already been damaged. One of the first signs could very well be abnormality in the creatinine BU and the electrolytes and so on. Take a look at the urine. How do you go from high cholesterol to looking at somebody's urine? Yes, because the high cholesterol, one of the organs that can get damaged is the kidney. The kidney is part of the 4 end organs that I talked about. So if your kidney is damaged, when you look at the sediment in the urine, that's important. So it's an abnormality that you could see there. When you also look for albumin in the urine, you might see increased level of albumin because the kidney is already damaged, you're pouring out albumin, so on and so forth. It's very important to check the coagulation profile. You do all that stuff. And of course, now we come to do what's called a lipid profile. The same tubes of blood that is drawn to do the chemistry, you could do the lipid profile. The lipid profile has certain components to it. The cholesterol, that is the total cholesterol, the LDL cholesterol, the HDL cholesterol, okay, the triglyceride, the ratio of the LDL and the HDL cholesterol, crucial. So you send that off, you're going to get all that back, okay? Important to check the patient thyroid. How do you go from high cholesterol to thyroid? Very important. Because if somebody has hypothyroidism, they can also have high cholesterol. They may be obese as well. Obesity, hypothyroidism can cause obesity, can be associated with it. So you look at the thyroid profile. And while you are at it, if you want to practice 21st century modern medicine, you do an evaluation for thrombophilia. Absolutely. Absolutely. Why? Because of all the most common thrombophilias, elevated lipoprotein A, a whole lot of other abnormalities that you could find, homocysteine, and so on and so forth. How about the lipoprotein A? 20% of the U.S. population have elevated lipoprotein A. Why is that important? Well, it turns out that LDL cholesterol and elevated lipoprotein A together work in unison to increase occlusive disease or arterial occlusive disease. How about that? Let me repeat that. So for folks who didn't know this stuff when they were in training, because those knowledge were not available then, that is why you do a thrombophilia evaluation. There's about a dozen different abnormalities that can be found in the blood that you know nothing about. Some of them you inherited, some of them you acquired during lifetime. I'll give you one example I just told you. Lipoprotein A works in concert with elevated LDL cholesterol to increase plaque formation in the arteries. You've never heard that before, you just heard it. That's important because when you're going to treat the patient, also when the patient is symptomatic, having problems. I read stories the other day about all this Alzheimer's disease and black and so on and so forth. Some of it is totally bogus. The vast majority of black folks / Negroes who have memory problem because they have microvascular disease of the brain associated with high cholesterol and or elevated blood pressure. Nothing to do with Alzheimer's. The symptoms are the same, but the cause is different. The causes are different, so therefore the treatment, therefore, completely different. So now you check your uh, coagulation profile, as I mentioned. You do all this. Almost always, when you're doing these things, seeing somebody for the first time, you do an ANA, you do the saturate, because there may be other conditions that are associated with all these things that you may doing a great job treating the cholesterol, but you forgot that the patient is still symptomatic because there are these other stuff you didn't know anything about, you didn't test for them. And the patient may be having problem with them, you would never know. Remember, you get one chance to take care of a patient, you may not get a second chance. You may never see the patient again. And then down the line, somebody else pick it up and you get blamed for stuff that you didn't do. Be complete. It has nothing to do with perfection. You just have to develop a method. I have a sheet, I don't think it's here in the other book that I showed you in the past. There's about 190 different tests on that sheet that I use in my office. There's not a single disease that is of major nature in this country or across the world, for that matter, that you cannot diagnose if you have this form in your hand and you know what to do with it. She got all this stuff. So they did the blood test. The results are pending. Then you do an EKG. Crucial. You do an echocardiogram. You do a chest x-ray. Crucial. Because cholesterol can cause heart problem. The heart may be enlarged. You could see that on the chest x-ray, even though that's not the most sensitive part. The patient may be in heart failure. The chest x-ray might show that. The echocardiogram will show you if damage have already occurred because of hypokinesis. The muscle cannot contract properly. The ejection fraction may be very low. And you could calculate the ejection fraction by doing the echocardiogram. The ejection fraction tells you in a millisecond what the heart can do in terms of contraction. So the echocardiogram tells you that. The EKG will tell you if there's damage that's already occurred to the heart, if you know how to read the EKG. You have certain arrhythmias, such as atrial fibrillation. The EKG will be able to tell you that. So EKG, chest x-ray, echocardiogram is part of the evaluation of somebody who has abnormal lipid. Chest x-ray, crucial. So these things can be done in most big groups, offices nowadays, and or people like me who don't have a fancy office, I just send them to the hospital while the blood is cooking. These things are cooking. Sometimes I got this result before I get the blood back. This thing I'm going to sit here, stop right here. I'll continue this discussion next week. Until such time, this is Dr. Alcena saying so long and bye-bye.